All right, a very good afternoon, dear members. Welcome back from the lunch. I'll start probably as our IT specialist is setting up the presentation with some preliminary remarks. My name is Musanje Geofrey. I come from Nakaseke Hospital. I'm the pharmacist in this hospital. Nakaseke Hospital is located in central Uganda, some good kilometers away from here. Nakaseke Hospital is at the level of a general hospital. It offers services just like any other general hospital in this country, of which we have both the OPD department and the inpatient. We have the special clinics. We also have special services like the NCD clinic. Nakaseke Hospital serves both as an attachment for students, medical students, and also interns of the various cadres. Next, please. A little background. Sorry, I didn't talk about the topic because I was waiting for the slide. Just take us back. So what I need to talk about is embedded in that preamble. I'm going to give a brief about the state of antimicrobial stewardship in Nakaseke Hospital. Okay, so just a little background. Nakaseke Hospital, just like any general hospital, adopted the guidelines of Ministry of Health, which was to set up medicines and therapeutics committees, which were meant to oversee and guide the use of medicines and related services within the hospital. In 2023, we actually saw this committee break up or form subcommittees, and one of the committees that was formed was that microbial stewardship subcommittee. This committee held several meetings ever since it was formed. And out of this, we've actually seen that a lot of discussions and interventions have actually been brought up, as we shall see along. Next. So some of the activities that we've seen that this committee set up, please, next slide. One of the activities was to do a baseline survey. And in this baseline survey, we reviewed prescriptions at OPD for 1 week. 5 working days, and we reviewed over 630 prescriptions. And out of these, our main focus was mainly looking at scrutinizing out and see the trend of prescribing of antibiotics and rational prescription. So out of these, we actually saw that over 70% of the prescriptions had antibiotics. However, it was a shaming that over 50% of them, we saw a lot of irrational prescriptions or irrational use of the antibiotics. So as a team, we actually came up with some interventions. The immediate one is that we set up a prescription errors book at the pharmacy window, being it is the window that scrutinizes every drug before it comes out based on the prescription. This helped us actually to identify these particular gaps, of which we held a CME for the prescribers and the other health workers to see that we try to get on form. And even the interaction between the pharmacy department to scrutinize and liaise with the prescribers to adjust these prescriptions was also another strategy. And the outcome of that, in brief, is that we saw an improved mindfulness amongst our prescribers when it comes to prescribing antibiotics. And they made the prescription errors in antibiotic prescriptions reduced. Next, please. Another activity, this was a great activity that we had still last year, where we are privileged to be organized. I would say to be organized because we didn't host, but at least it was an initiative that came through CW PALMS in conjunction with Makerere University School of Public Health and Nottingham Trent University. We had that training. And in that training, you can see on the first picture that it is malt. So just know it is malt. In that we are seeing even people from other countries. So we see representatives from the UK, we see leaders at the district level of the hospital, we see leaders from CW PAMS, we see health workers from the various health facilities in the district. We also see the community engagement through the operators of drug shops and clinics. And also we see colleagues from veterinary medicine. Because when you talk of the concept of One Health, there is no way we can actually avoid the whole sphere. And on the other side, we actually see, that this training was participatory because it was aimed at equipping, empowering the health workers and all the other people to go back and spread the gospel about antimicrobial stewardship. Next. The other initiative is that this came around the AMS week. We sat down and said, so this has come up, so what should we do very fast? So we said, at least let's create a group and awaken people and let them know. So we immediately formed this group. I started this initiative, and we looked through the phone and picked all the possible contacts, and we had almost 200 people being awakened and arisen on the issue of antimicrobial stewardship. And this platform has been, from its start, it has been a very good platform for us to actually promote or maintain the wave of antimicrobial stewardship in the district. And what you see on the other side is actually the new initiative that we're actually bringing on board in social media, of which we want to start actually having a statement or a slogan about antibiotics. And we shall have one of the members from this group, from this WhatsApp group of ours, and then we see what message they deliver. So in particular, you can see that says that antibiotics are not salt. They aren't needed in every meal. Is there any meal you can eat without salt? You'll always need some salt. So, but at least for antibiotics, they shouldn't be treated in that sense. And this is spearheaded by one of our colleagues at the hospital.
Geoffrey,
next,
you have
please.
1 minute.
Oh, yes. The last one is that we are able to do a GPPS early this year. And this still was spearheaded by Makerere University School of Public Health. They came, and actually number one was to build capacity amongst us and create a team of 2 teams we actually created. And then after we actually did the exercise there and then. And this will go on and on. Next, please. The future prospects that we have is, number one, we want to do culture and sensitivity tests for surface swabs in the different key departments. Maybe we are surviving with some of these resistant microbes and we don't know, so it is good for us to do that. 2, we want to come up with a policy to guide parenteral oral switch of antibiotics, because we know it is more cost effective and reduces hospitalization of patients. And then 3 is that we want to organize a 2-day workshop where we shall invite health workers, especially the prescribers, from the lower facilities in the district. We have over 25 lower facilities, and we have them also join the wave. Finally, I will say that CW PAMS has had a substantial impact on antimicrobial stewardship in Nakaseke Hospital and the district at large. And for us, we are very sure that the capacity that has been built in us will go on and on. And for the surveillance, we shall keep on and on, just as we've promised. We look forward to continuity of this engagement and collaboration with the various partners, because all we want to see that Nakaseke Hospital becomes a center of excellence and a pace setter for other health facilities. Finally, I will now say that just as the theme of this conference says, that we are advancing health equity through collaborative action. I can say this wasn't our efforts alone, but already this was the collaboration of this whole team. So I wish to acknowledge the MTC team of Nakaseke Hospital, the leadership of Nakaseke District. I also wish to acknowledge strongly the partnership of NTU and MAC for the wonderful support and technical guidance in all this, and finally, Ministry of Health. Thank you so much.